evening. Good evening. Welcome to this video on medications for mental health disorders. The video is part of the course on psychopathology in social work and is being presented to Dr. Marek. I hope you will enjoy the listening. Medications for mental disorders is attracting a lot of attention these days because of the many side effects that are associated with medications for social or for mental disorders. These side effects include dryness of mouth, dependence, sedation, weight gain, and suicidal thoughts. Due to these critical factors of that are associated with medication, psychiatrists and social workers are being forced to rethink about alternatives to pharmacological treatment of mental health disorders such as cognitive behavior therapy, DPT, sunlight therapy, nutrition, and even addressing biofactors. It's also bringing attention to the need to address psychological factors as well as social factors such as housing, job security, incarceration, employment, stability in families, and all that. And all these factors cannot be treated by medications alone. We are going to have a look at the many medications that are available for the treatment of mental disorders. Psychiatrists like Katzman and Locke have proposed that there are 3 levels in which medication is administered. The first one is the primary level, which is the entry level, the first line of treatment when somebody presents themselves with a mental health weakness. The second one is the second line of entry, where after the first line of entry has not worked or is insufficient, the psychiatrist adds another line of medication. Then there is the tertiary level, which is for resistant, mental health disorders, medications for anxiety disorders. At the primary level, the known medications for anxiety disorder is Lexapro and sertraline. These are first generation medications which are addictive, and clients tend to depend on them. At the secondary level is buspirone, which is non-sedating, non-dependent, and takes time to work. So once you start taking it, you may take some time before the effects of the medication is realized. At the tertiary level is the pregabalin, which has a lot of side effects, and there is also clomipramine. These are tricyclic and antidepressants, and some people gain a lot of weight when they take this medication. Bipolar and mood disorder. The primary medication for bipolar mood disorder is the lithium and Divla-Prox slow release. This medication contributes to weight gain, and the secondary ones are dual mood stabilizers like valproate together with lithium, or a combination of lithium, valproate, and antipsychotic medicine. To some people, these medicines have dependency or sedation. Tertiary medication for bipolar include usually for the treatment of resistant bipolar include clozapine and chlorpromazine. Again, this medication can lead to weight gain, dry mouth, and very uncomfortable situations. So that's due to these side effects. That's why we are proposing the need for combining medication with other alternative treatment like CBT, light therapy, exercise, nutrition, etc. Personality disorders. The primary treatment for personality disorders is the SSRI, which are the serotonin uptake, which control serotonin uptake for depression and anxiety. They also include sleep-focused agents like trazodone. Secondary treatment include mood stabilizers like lamotrigine, valproate, and topiramate. And also, in addition to a typical antipsychotic like quetiapine and aripiprazole. And some of these cause anxiety or TD, tremors, where somebody taking the medication shakes and can't hold things firmly. Other tertiary medication for personality disorders are clozapine and benzodiazepines. Again, they cause TD, another sort of disease. Schizophrenia spectrum medication, the primary are aripiprazole, risperidone, and long-acting injectables, which when you get the long-acting injectables, it's not easily exited from the body, and it can cause a lot of effects, affect the liver, affect kidney function, and many other things. Tertiary is the clozapine. So that's why we recommend that when you have schizophrenia, you combine CBT, DBT exercises and yoga in the treatment so that it does not affect the body. Then there is trauma adjustment disorder. This is the primary treatment is Selatrin, like Solto, paroxetine for depressive mood. And for secondary line, we have Ventrafax for taking care of serotonin and norepinephrine modulation. Tertiary, you have prazosin and propano, which is a beta blocker. And propano is one of the disease where when the heart rate is below 60, you should intake. So as a social worker, you prepare your client and alert them that when a client to monitor their blood pressure and especially the heart rate, so that when it is below 60, they should not take the medication. Ethical responsibilities for the social worker to the broader society include addressing systems, policy, and public conditions that relate to medication and drug use. And one requirement is that the social worker should promote the welfare of the patients, address drug addiction, overdose, and risk. The social worker needs to prepare the client about suicides, drug addiction, and overdose. And also the social worker to help in the addressing of issues like housing, employment, reduce substance harm, and mental health issues. You find that one can be on medication, but if they have no housing, they are not going to heal. If they are not unemployed, they are not going to heal. If they are suffering from domestic violence, they are not going to heal. If they are at the risk of being incarcerated again, they are not going to heal. So the social worker needs to work towards advocating for this thing. Address the pill mill that harms community, and also address the stigma associated with the disease, build the community voice, ensure that community participates and can lobby for itself, encourage the community to take political action where necessary, advocate for equitable distribution of resources in communities, focus on the need for special category groups like the youth, domestic violence survivors, the incarcerated, and children. So what I'm trying to drive at in this video is that together with medication, there is need to also think of intervention in terms of non-pharmacological interventions, and such ones include cognitive therapy, cognitive behavior therapy, DBT, yoga, swimming, exercises, and advocacy for equality and all that. Thank you for listening to me and have a good evening.